So that's rolling. And now I'm going to start, whoops, I'm not holding it properly. I'm going to start this. Ready?
Mm-hmm. Good morning, everyone. This is Dr. Thomas Bartell, board-certified plastic surgeon, specializing in body recontouring surgery. And we're here again on Friday. And today we're going to be chatting about common misconceptions that patients come in with about various plastic surgical procedures. Sometimes they get these misconceptions from their other plastic surgeons, but most often they come from the internet. Once something's on the internet, of course, it can never leave the internet. And as we all know, everything on the internet is absolutely correct and true. The first one I want to talk about is recovery periods. And this patients often get from their own, from other plastic surgeons. They hear that if they have a particular surgery done, they're not going to be able to resume their normal activities for perhaps several months. They won't be able to go back to the gym, or they won't be able to travel, or they won't be able to lift a small child. And some of these recovery periods are just ridiculously long, and it's just silly. For most of the surgeries that I do, breast surgery, body recontouring, recovery periods generally tend to be in the range of 2 to 4 weeks. After that, most folks can resume normal activities. It doesn't take a lot of time off to have these procedures done. Now, obviously, everyone is different, and sometimes, occasionally, patients will need longer. Sometimes it'll take shorter amount of time. I have specific requirements that I have for each procedure, how much time you need to take off. For instance, for abdominoplasty, a tummy tuck, I don't want anyone lifting anything heavier than their shoes or their purse for 3 weeks, because I want to maintain the integrity of my repair of the abdominal foundation. But for other procedures, such as a breast augmentation, after 2.5 weeks, you can go back to the gym and do bench presses. You're not going to bother my implants at all. You can lift your child, raise your arms. It doesn't take very long to recover from these procedures. So for each procedure, if you're interested in knowing exactly how long you're going to need to take off, just come on in and we can chat about it. The next is liposuction. There are a lot of different types of liposuction advertised out there. Traditional liposuction, ultrasonic liposuction, laser liposuction. It seems that every 2 or 3 years a new machine comes out that is the latest and the greatest and will give you the best result. Well, this is my opinion, but the results of liposuction aren't in the machine. They're right there. The hands and the experience of the surgeon performing the procedure. That has a lot more to do with the results that you can get than the newest and greatest machine that's out there. And believe me, these machines are not cheap. They're very expensive, and it's not the doctor that's going to be paying ultimately for these new and greatest machines. It's you, the patient. It just doesn't make sense to require a procedure with a new and great machine with a doctor who's not going to be able to give you the best results. I use traditional liposuction. I've been doing this for almost 30 years. I'm very good at it. I just don't see a need to buy a new machine every 2 or 3 years, just like you buy a new computer or a new telephone every 2 or 3 years, because it's not going to give you really much better results. The most common misconceptions that I get in my practice are about implants, augmentation, breast implants. The first one is about the difference between silicone and saline. There are a lot of doctors out there who only do silicone implants because that's what they've always done, silicone implants. And they will advertise these implants as the best because they feel more natural, more like a real breast. And they'll often, what they'll do is with a patient in the consult room, they'll take a silicone implant and a saline implant, and they'll put them on the table and say, you feel, which one feels more like a real breast? And you feel it, say, oh yes, definitely the silicone implant feels like more like a real breast. I agree 100% with that. A silicone implant feels more like a real breast when it's sitting on a tabletop. However, that's not where the implants are. Implants go under the skin, under the breast, under the muscle. They're deep inside a patient. It's just taking up space. That's all an implant does, no matter what it's made of. It's just taking up space, pushing what you naturally have forward. So what you see and feel on the outside is you. It's not implant. So when you put a silicone or a saline implant under the muscle, what you see and feel on the outside is breast. So that doesn't matter to me. It doesn't make any sense, this argument about what feels more natural. All right? The advantages of a saline implant, I think, far outweigh the advantages of a silicone implant. With saline implants, they are safe. If an implant ever does leak, you get a free one from the manufacturer. They're guaranteed for your lifetime, and I'll put it in or someone will put it in for you. A saline implant, you can continue to have mammograms, whereas with silicone implants, they usually recommend MRI scans, which I guarantee your insurance company ain't going to pay for. And with saline implants, they're adjustable in the operating room. With a silicone implant, it comes from the factory. That's what you get. With a saline implant, each implant comes with a minimum fill volume and a maximum fill volume, and I can use that range to correct any asymmetries that I see, and I can adjust them if I don't think we've got you where you want to be. So for those reasons, I like to use saline. Now, with very, very thin women, saline implants can have a higher incidence of rippling, being able to feel the edge of the implant over silicone implants. But now we have an answer for that. It's called the ideal implant. It's a new implant, it's been around for about 2 or 3 years now, that has a much lower incidence of rippling than a traditional saline implant, but it's still made out of the same stuff. So if you want all the advantages of a saline implant, but less rippling, and you're very, very thin, that's the implant that I usually recommend that you go with. So I don't see any real advantages with a silicone implant, and that's why I don't use them. Now, another misconception is, and this comes mostly from the internet, you have to replace implants every 10 years. That's a holdover from the old liquid silicone implants. We used to try to replace those before they leak, and they always leaked by 10 years because if they leaked, it was a real mess, and you had to clean that out. So we'd always recommend that they be replaced every 7 to 10 years, so the patients always had to come back. With a saline implant, you don't have to do that. If you're not having trouble with a saline implant, you leave it alone. Don't let anyone talk you into having it replaced. If I were having to replace all the saline implants I put in the last 25 years, no one would get an appointment today because that's all I would be doing. There's so many thousands of implants out there, that's all I would do. So saline implants, if you're not having a problem with it, leave it alone. So that's basically it with the implant issues. Now I think the most important misconceptions that patients come in with is which surgeon should be doing your surgery. And there are two issues here. Which surgeon is best for you, and which surgeon is best for the procedure you want to have done. Surgeons that are best for you are the ones that listen to you. They listen to your concerns. They listen to what you want to accomplish. The best surgeons for you are the ones who explain everything to you. What the procedure is, what the post-op recovery will be, who will be taking care of you post-operatively. Some surgeons out there, they'll pass you off to the surgeon on call. I take care of my own patients 24/7. The best surgeons are the ones who will show you numerous before and after pictures. Some docs don't do that. They just don't have them. Well, a patient comes to me, I think they deserve to see what kind of work I do. And I have numerous befores and afters for every procedure that I do. If you want to see them, come on in and I will show them to you. Most important, I think, the best surgeons for the procedure that you want to have done are the ones that have the most experience. There are a lot of surgeons out there who will claim to be specialists in cosmetic surgery or even cosmetic body recontouring, and they'll have that on their website. But if you do your research, you'll realize, yes, they do that kind of operation, but that's not what they specialize in. They do everything. They're generalists. You know, I'm sure everyone's heard the phrase, jack of all trades, master of none. Well, if you want a master of body recontouring specialist surgery, that's me. This is all I do. I just do body recontouring. You can go to their website, you can talk to them, but if you do your research, they're the generalists, I'm the specialist. So, that's about it for today. I know we were all enjoying the spring-like weather last week, but unfortunately that's not what we have now. When it gets cold like this, especially in the middle of winter, what I like to do to try to keep warm is to imagine myself on a nice warm beach, usually in the Caribbean somewhere, with a palm tree right behind me and an umbrella drink. So you do what you need to do. I'm going to try to keep warm. We'll see you next week. Thomas Bartell.